Okay, welcome everybody. My name is Marty Mascari. I am a contractor with the North Central Texas Area Agency on Aging. With us today we have Doni Green, who is the Director of Aging Programs for the North Central Texas Area Agency on Aging. We have Jamie Cobb and Holly Glover, who are both with the James L. West Center in Fort Worth. And thank you for joining us. If you advance to the next slide, we will, Jamie, I'll let you go over the CEUs with everyone, if you would.
Yes, we are happy and excited to be able to offer social work CE credits and licensed professional counselor CE credits. This will be for 1.5 hours. After you do the webinar, and you do need to stay on for the entire length of the time, you will get an email with a link to an evaluation. Once you complete that evaluation, then you will be sent your CE certificate within 5 to 7 business days, and that you'll be able to have that for your career.
Very, very good. And then the Survey Monkey will go out with the follow-up email that I send out probably within about an hour after the completion of this. And then you'll get a second email, a follow-up email in a few days that also has a link to the recording for the webinar as well. One of the things I'm going to ask you all is we usually, because of the numbers, we really ask you all to put any questions you might have either in the chat or in the Q&A. We're going to stay away from raising hands if we could, just because muting and unmuting, the way webinars are set up, you can't unmute yourself, and it just takes too long for us to find who to unmute and the technical difficulties that come with that. So we're going to ask you to, again, put that in the chat or put that in the Q&A. So you can go to the next slide, Jamie, and we're going to welcome Jamie Cobb. Jamie's going to talk to us about reducing care partner stress.
Yeah, what a if you're listening to us before this, what a timely topic, because of not only does life happen, and it throws curveballs at us and can cause stress, but then there's caregiving that causes stress, and now COVID-19. So today we're going to talk about how stress affects our well-being, recognizing what that looks like, signs and symptoms of particularly chronic or long-term stress. And then we're going to talk about ways to help reduce that stress. And they're proven ways that show that we can really reduce our stress, but increase our ways of coping and coping better. So our learning objectives, again, define symptoms and the effects of long-term stress. We'll illustrate a stress profile, your individual stress profile, describe self-care and support tips, again, that have shown to reduce stress levels. Examine proven techniques on changing negative thought patterns and identifying best ways to ask for and accept help. And I know Doni will be talking a lot about resources in the community that you can take advantage of. Just a bio of me. I've been with the James L. West Center for almost 10 years now and been working with families living with dementia and their family members for close to 15 years now. So I have some professional experience, but I also have personal experience as well with my mother and some grandparents. And then I might share some stories with you all today. Let's outline what we're doing. So I wanted to start with this want ad for a caregiver. See if any of this resonates with any of you. Wanted, a full-time caregiver, must have unlimited stamina, be energetic, alert and attentive, friendly and caring, totally understanding, and forever patient. Must be willing to always subordinate your own needs to those of the patient and have few, if any, other commitments. Must know how to handle any situation. A background degree in psychology, human relations is preferred, plus basic nursing skills, basic knowledge of medications and their interactions, as well as side effects. Must be prepared to work for no pay and expect a little, if any, appreciation of the above abilities from the patient. I really love this want ad for a caregiver because that's what it is sometimes, right? It's just demanding. It's so many things that come along with providing care or being a care partner to somebody else, no matter what illness they may be living with. It's hard. And on top of everything else that we do in life, this is adding something else onto it. So there is a caregiver self-assessment out there. It's an 18-question assessment. And I'm going to ask you these 18 questions right now. And we'll send you a copy of this in the resources Marty sends out later as well. Because I think it's important to do a caregiver self-assessment periodically to kind of gauge. It helps you gauge where you're at. But also as your responsibilities change, your loved one's conditions change, your stress level might change as well. And this really helps us hone in. How are we doing and how are we caring for ourselves? So just to yourself, answer yes or no to the following questions. Have you had trouble keeping your mind on what you were doing? Felt that you couldn't leave your relative alone? Had difficulty making decisions? Felt completely overwhelmed? Felt useful and needed? Felt lonely? Been upset that your relative had changed so much from his or her former self? Felt a loss of privacy or personal time? Been edgy or irritable? Had sleep disturbed because of caring for your relative? Had crying spells? Felt strained between work and family responsibilities? Had back pain? Felt ill? Been satisfied with support my family has given me? Found my relative's living situation to be inconvenient or a barrier to care? So answering yes or no to any of those questions. But now on a scale of 1 to 10, with 1 not being very stressful at all, but 10 being extremely stressful, rate your current level of stress, like today's level of stress, on a scale of 1 to 10. And then on that same scale of 1 to 10, 1 being very healthy, 10 being very ill, please rate your current health compared to what it was this time last year. So answering these questions, you know, some of them were positive questions, like I felt supported by my loved ones, right, in the care that they helped me in caregiving for my loved one. But a lot of these are really kind of warning signs and really giving us opportunity to do a self-check, you know, and with myself on how am I doing and am I practicing good self-care? You know, on these and how you score this, and you'll receive this information on these last 2 questions using the scale of 1 to 10. If you rate 5 or higher on either being extremely stressed or feeling very ill, and then you need to take immediate action on really reducing your stress or talking to a doctor or getting some help. Because nobody can care, be a care partner or give care to somebody 24/7. And just the latest statistics, or at least from 2020, the numbers of Americans providing care, and it's usually unpaid care, so these are our friends and our family members, has increased over the past 5 years. In 2015, there was about 43.5 million. Now there's 53 million. And of those, it says nearly, you're caring for more than just one person. So 18% in 2015, now it's 24% of people are providing care for more than just one person. There's 2 people there. They're also having more difficulty coordinating care, from 19% to 26%. And more Americans are finding themselves caregiving for somebody with Alzheimer's disease or dementia. In this one, 17% in 2015 to 21% in 2020, more family caregivers report their own health is fair to poor. And 45% have had at least one financial impact. And over half, 61%, are still working on top of all the caregiving responsibilities. So I think in a way it's kind of nice to know we're not the only ones out there caregiving, right? But also seeing that this is an epidemic. I mean, we're going to be caregiving. And Rosalind Carter, one of her famous quotes is, I hope I don't butcher it, but there's 4 people in the world. Either you will be giving care, you will be providing care, you have provided care, you will be giving care. I mean, this is just going to be part of, or it is part of our culture and how we live, and we need to learn how to do it well and do it healthy.
Jamie, we have a comment that's submitted in chat. What about a caregiver who's a spouse thrown into this role? And you're talking about spouses and all other types of family caregivers, correct?
I am, yes. So really, thank you, Doni. This is, you identify as I'm providing care for somebody that I love, whether it's a spouse or a sibling, or it's my friend, or anybody that I've known for a long time, anybody I love. That's what I'm talking about, is your caregiver, care partner for that person. So I hope that helps clarify that. So just providing care for anybody that you love, whether you're related or not, right? And because there are responsibilities that come along with that. And unfortunately, there's stress that can come along with that too, because stress is a feeling of being troubled or threatened by life. And it's how our body responds, but it's how our body responds, not just physically, but mentally, emotionally, and spiritually to any change, anything that changes or maybe we feel threatened by, or any demand in our lives or event in our lives. And stress is a normal feeling. It's a normal response. But whether, there's a short-term stress and there's long-term stress. And both of them can contribute to health problems, but particularly that long-term chronic stress, which most caregivers do have, what does contribute to physical issues, mental issues, emotional issues down the road. And that's what we're going to address today. So like I mentioned, stress is a normal response. In this visual right here, what's happening is we go along in life and everything's normal. It's kind of our homeostasis. Everything's going along normal. It's as expected as we want it to be. And then something happens, whether it's a diagnosis of an illness or it's a car accident. And then our bodies physiologically go into a stress reaction. And what happens is our blood pressure goes up. Our cortisol level, so the brain releases cortisol and adrenaline into our system. And cortisol is known as that stress hormone. Our heart rate goes up. Our muscle tension usually goes up as well. Our breathing becomes more shallow and more rapid. Our digestive system doesn't work as well, and our immune system is not working as well either. So this body goes into this hypervigilant state. And for a short period of time, it's helpful, it's good. We're glad our bodies do this because it helps us respond either fight, flee, or freeze, right? Those basic responses that our body goes through. But with this thing, it helps our brain activity also goes up. So we're able to act quicker and respond quicker, especially if it's, a car wreck or I have a blowout on the freeway. I know exactly what to do. I'm just working faster and working better, clear, and I can pull over without hitting somebody else, and I've gotten into a safe spot to get that fixed. Or if I get into a car accident, I can pull over. For a short period of time, this response our body goes into is helpful. But generally, these short-term stressors, either, everybody's fine from the car accident, you exchange insurance information, and you can go back to normal. You can start to breathe. Well, the body, the stressor either goes away or it's managed, right? And the body starts to go out of this hypervigilant state and goes back to that normal state. So the blood pressure goes back down. The brain stops putting cortisol and adrenaline into our system. Heart rate goes down. We're able to breathe slower and deeper. We can relax. Our muscle tension goes down. Digestive system starts working better, and so does the immune system. And that's a normal thing. The body goes stressful state, but then it goes into a relaxation response. So here, what happens is our body or the stressor doesn't go away. Or, we got that diagnosis, or, dad can no longer live by himself. Dad went to the hospital and now he's got to come home and stay with me. And I don't know how long this is going to be, or how many responsibilities now I have, or how to take care of them. So that stressor really never goes away, or it's not managed well. So our bodies stay in this hypervigilant state for months and months and years. And if you can think to yourself, what happens to the body at that point? You're in this stress response state for a couple of years. Well, what tends to happen is the body can't take that state for very long, and it'll start to get sick. That's why there's a statistic out there that, and I might have it a few off, but about 68% of caregivers will pass away before their loved ones do, due to a stress-related disorder or a stress-related issue. So I can't have my blood pressure up so high for a long, long period of time. That cortisol level, it's that hormone that gives us belly fat we hear a lot about, but that cortisol level after a chronic, being chronically dumped into our system, will start to attack our brain and the hippocampus part of our brain, which is our short-term memory. So there's some permanent damage that can happen if we don't manage our stress levels. So we have to learn to, even though we might have a long-term stress, like being a care partner for somebody, we have to learn how to get our bodies into a relaxation response so we can manage this better. What this looks like and the effects of long-term stress is it does affect our entire well-being. So there are physical responses, and on here I've listed some symptoms of that. It can look like you're sleepless, can't sleep at all, you're having some digestive issues, fatigued, muscle aches, maybe you sweat a lot more than normal, you're in pain, and this can be physical pain, you've got back pain all the time, got headaches all the time, or it can be emotional pain as well. Maybe you have an increase in appetite or a decrease in appetite. You can have a rash, you can grind your teeth. There's a lot of physical side effects or symptoms of a long-term stress. Emotionally, what it can look like is you've got increased anger. This is not your normal, anger threshold. It's increased. You feel guilt more. You're more sad, more anxious. Maybe you're in denial, resentful about the situation, or maybe you're starting to be resentful about people or the person you're caregiving for. Feeling hopeless, a lot of self-doubt, difficulty concentrating. And then the mental effects of this. You can have increased thoughts of worry or anxiety. Maybe you're starting to notice that you're becoming more forgetful or confused about things. Maybe there's a rumination, or you're overthinking, or you can't stop thinking about what's coming up or what I just did or why is this happening. It can be a loss of interest in work and play as well. And then behaviorally, what we can tend to do behavioral-wise is I can withdraw socially. I don't connect with my friends anymore like I used to, or I can withdraw inward and I just kind of bottle up my emotions. You can start blaming others. I can self-medicate, and that can be with drugs or alcohol or food or sleep or shopping. There's a lot of things we can self-medicate with. Can react in anger. I can start biting my nails, ignore personal hygiene, and just deviate from my normal self-care routines. So this is not an exhaustive list, but these are some signs and symptoms that I am having some long-term stress that's not being managed well. And I have that stuff up there not to scare anybody or to make anybody feel guilty about anything, but it's important to know what our stress profile looks like, because nobody is going to stress out the same way as the next person. We all respond to these changes in our life a little bit differently. What might really stress me out might not bother Holly at all, because we're different people, right? And we've had different life experiences and learned from different things. So I need to know, what is my stress profile? What does it look like when I am stressed out? How do I feel? What are the thoughts that I have? How do I physically feel and emotionally feel? And how do I start behaving? And if I can recognize those signs in myself, I can use that as a gauge to say, I need to do something differently to really start managing my self-care, or to start feeling better, or use it as there's something that's got to change, because I can't do this for a long period of time, at least not without consequences, right? So you can ask yourself, when I'm stressed out, I typically have thoughts like, this is too hard, nothing's ever going to change, and I'm not good enough. Or you can ask yourself, when I'm stressed, I tend to notice that I have a lot more headaches, my stomach just hurts all the time, and I'm fatigued. And then this is how I tend to react or behave. I do withdraw inwards, I disconnect from others. I lash out at others, and I really have a hard time finding any joy or happiness in the day. So that's my personal stress profile, and I can use this to understand something needs to change, or I need to change my coping skills or reduce some stress to be successful at continuing to care for my loved one. Because at the end of the day, we are wanting to provide the best care for our loved one. And honestly, we cannot do that if we are stressed out and we are feeling bad about ourselves physically, mentally, and emotionally, and we're running on empty. I don't have what it takes to give the best quality care to my loved one. And that's what we want to do. So I hope everybody would agree with me when I say, when the health and the well-being of the care partner is threatened, then the care receiver is in jeopardy. It's hard to take care of somebody when you don't have the energy or the patience or even the mental want to take care of somebody. It is. We need to be honest with ourselves, but recognize those signs in ourselves as well. So let's talk about ways, the proven ways that you can start to reduce your stress, start to relax that body, and add value back to your life and be able to provide that quality care to your loved one. No matter how hard I try, I cannot give everyone around me what I do not have. And honestly, a lot of caregivers do that. They just give and give and give to everybody, or that one person that really needs it, and give and give and give. But there's going to come a point where you don't have anything left to give. And then how are you going to give to other people? So you can't pour from an empty cup. We deplete ourselves if we're not careful, if we're not practicing self-care. And I don't have anything to give anybody. So I want to make sure that I fill my cup up with self-care, and that is taking care of yourself first. So some best support tips, kind of wrap our mind around how am I going to start doing this? Accept your own limits. Ask for and accept help. And I'll give you some tips on best ways to get help. And I know there's a lot of great resources Doni's going to give you as well. And creating a support team that's there, it's like caring for the caregiver. And you need that support team to be successful. Get organized, prioritize, and establish a routine. I read a quote the other day, and it said, make what's important, important, and prioritize it. Figure out what is important, put that at the top of the list, and then get organized and start make what's important, important. And I'll tell you what needs to be on the top of that list, because this is very important, is your own health. Your own health, and physical, mental, emotional, spiritual health needs to be at the top of that list. So you need to schedule it, and I mean physically write it down, because whether you feel like you need a break or you feel like you need help right now or not, you got to start scheduling in personal time or that self-care time, what that looks like for you. You got to organize it and you got to stick to it. So you really have to guard your time that you've scheduled for yourself and make sure that you set enough time aside for yourself. It's a non-negotiable. So don't let other people take that away from you, but also don't make it the first thing that gets put on the shelf. It's got to be a first priority. So your support team. So one way to look at being a care partner for somebody else is looking at it like it's an organization or a company. And so I have on here your name, Caregiving Inc. So if you put in there Jamie's Caregiving Company or Caregiving Inc., right? I know that I cannot care for my loved one 24/7 and meet all of their needs. It's impossible. I just can't. Nobody can do that for anybody, right? So you got to think about it kind of in organizational or company-wide manner. If you take a huge company like Amazon, for instance, there's not just one person running Amazon. There is a huge team of people that are doing all the things that are necessary to make Amazon successful. And I guess Jeff Bezos, what he did is he hired people that were better at him than certain areas to make his company be successful. And that's kind of the way that we need to look at being a care partner to somebody. So I need to have and create my team of people that I can trust and people that might, quite honestly, be better or have more skills than I do in certain areas to make sure that I'm successful, to make sure my loved one's getting the care that they need and deserve. So there might be, you have somebody that's your trusting sounding board. So it could be your best friend or a spouse, anybody that you feel comfortable talking with or venting to in a non-judgmental manner, and maybe just brainstorming, kind of that sounding board. Maybe that's a person part of your team, or you have a couple of those people. You have somebody coming in during the day helping, or at night coming in. Make sure your doctor or doctors, their doctors, and pharmacists are part of that team. Maybe you have hospice that's coming in or might come in eventually, and they're a part of your team. Maybe you have somebody comes in and helps with cooking or cleaning. You name it, it's anybody that's helping you be successful. You might have somebody you trust that really kind of does that legal paperwork thing over there, or somebody that helps research community resources and what's the best way to get help that I need. But it's looking at this and you have this team. Now knowing that you're still kind of the boss, right, in charge, and you can change job duties, or you can even say, hey, this isn't working out. I hired, the neighbor down the street to mow the lawn and kind of keep on my lawn. It's really not working out. But you have the authority to change that up. But it's kind of changing that mindset. You're going to have to learn and have to delegate, let go of some of this small stuff and allow others to come in and help you. But if we kind of look at it in this way, I need this team to help me be successful. So my loved one can be successful. It kind of helps us kind of wrap our minds around, all right, who do I need and how are we going to get through this successfully? Another one of the basis of starting to reduce your stress is learning to breathe, and learning to breathe with your abdomen. And this is it's deep breathing. And the reason I bring this up, because there's a lot of stress management techniques you can do that we will talk about a few more of them, but there's journaling, there's meditation, there's guided imagery, all of these things. At the basis of all of those is learning how to breathe slowly with your abdomen or with your stomach. So it's taking in a full breath, but taking in that breath with your stomach instead of your lungs. We tend to breathe pretty shallowly, and we're breathing with our chest. Well, that doesn't allow the body to take in the full breath of oxygen that it needs. So if you can breathe in with your stomach and push it out with your stomach as well, so your stomach's going in and out, your lungs are getting the full breath of air that it can take. It's your whole body's getting that full amount of oxygen that it needs in each breath. And as you exhale and push it out with your stomach as well, you're getting rid of that old oxygen and getting in the new stuff. This has been shown over and over and over again to lower blood pressure and lower heart rate and create a sense of calm in individuals. And this is whether you're just doing it random times through the day, or when you do it when something really did just happen and you went into that stress response. This is something, because this can be done anywhere, at any time. And you do it's the 4x4 breathing exercise. So you breathe in through your nose with your abdomen for a count of 4, a steady count of 4. You hold it, and then you release that breath for a count of 4. And you do that 4 times, your blood pressure and your heart rate are going to go down, and you will have a better sense of calm, and you'll be able to better problem solve as well. Because it's going to help stop that cortisol dump in your system so you can problem solve and respond differently. And then a sigh breath. You take in a deep breath, suck in all the air that you can, and your lungs are so full, and then you just push it out and make a noise. You do that a handful of times. That's going to lower your blood pressure and your heart rate as well, and it will relax you. And I say this, do this, practice it randomly throughout the day, so it becomes a normal response to you, especially when something that stress response does happen. Somebody said something, or you got an email, and you go into that stressful state. If I've already been doing breathing exercises, that might be my first response to that stressful state, as opposed to, the muscle tension and the anger. So another way to reduce your stress is to eat your stress away. Your diet is huge. There's a Dr. Burson, he said, we need to learn how to use food to lower the inflammatory stress in our body, that long-term stress. The typical response today is to reward our stressed out nervous systems with sugar and fat, which is a learned behavior, and it's prevalent because we do have calorie dense and poor nutrient food around us. It's easily available, right? Instead, we need to teach people which foods hydrate the body and lower an oxidative stress and give cells more energy. This style of eating that we teach at his medical practice, where we advocate for a diet in high greens, lean protein, and healthy fats, low in sugar, processed carbs, and chemically preserved food. A lot of what it's saying is that we start eating a plant-based diet, or even a plant-based paleo diet, which is lean proteins, but the rest of the plate has a plant base on it. That will automatically, your body will automatically start to be in a more relaxed space, because the body, the inflammation that the body responds to is going to be offset by the diet choices that you're making. And we tend to reward that nervous system, and it might be with that cookie, or it might be with that beer, but if I'm eating something, I can eat this stress away in that inflammatory response if I'm choosing good health diet choices. So a great diet that you can start using, and it's also been used or shown to reduce your risk for developing Alzheimer's disease and related dementias, is the MIND diet. And it's a hybrid of the Mediterranean diet and the DASH diet. And the DASH diet's the dietary approaches to stop hypertension. So these diets have been shown to reduce your risk for cardiovascular conditions and Alzheimer's disease, depending on how well you adhere to the diet, right? But what I really like about this is it's easy to follow, and it is plant-based. So right here, it says if you can just start incorporating 10 healthy food groups into your diet every day, and limit these 5 unhealthy food groups out of your diet every day, you're automatically going to lower your inflammation response in your body, but also increase that heart health and that brain health too. And you can see here, it's lean proteins with fish and poultry, but the rest of it's fruits and vegetables and the plant-based, the whole grains in there. Get rid of that processed food too, those sweets, the cheese, the stick butters. Of course, with any change in your diet, you obviously want to talk to your doctor about all of this, but start to think about how can I eat my stress away, along with doing that deep breathing, some other things we're going to talk about. So using movement for stress relief. The same doctor that talked about eating your stress away, saying the body is an excellent tool for channeling stress through movements like running or yoga or Tai Chi or walking or gardening. It can be anything. Movement is one of the greatest and most reliable ways to manage stress. I did hear it once say that you can metabolize stress out of your body, or metabolize some of that cortisol, that high sugar that can happen in our bodies through exercise, or through sweating, through exercise, and through crying. So you can physically get rid of some of that stress toxins through sweating or crying. Crying is therapeutic. Sometimes we had a big cry and we feel so much better afterwards. We just got rid of some stress. After we exercise or do some movements, we feel better because we just got rid of some stress. Not only are we also being healthy for our heart and our brain and our muscles and our bones as well. So start incorporating this as a proven way to reduce stress in your life. And using music to relax. Emotions or memories are tied to music, and music can influence our emotions. So if you want to use music to relax, it can be anything from having on some calming music in the background, having your favorite song. Maybe you need some energy, having that favorite energetic song going on to help give you some energy and get you motivated to maybe get out of the bed that day, or get you motivated to get through this next task. But to use it as an actual stress management technique is really scheduling that time, that uninterrupted time, to sit down and select music that you like, but music that you find relaxing, peaceful, or anything that's going to be for the purpose of releasing your stress. Get into a comfortable place, get rid of any distractions that can possibly come up, and give yourself at least a half an hour, if you have it, It can be even 10 minutes. It can be 5 minutes if that's what you have. But dedicate that time to relax just by listening and being mindful in the moment with that music. And it will reduce your blood pressure, reduce your heart rate. You will have a sense of calm. And it can be used several times a week as either a pause in a stressful situation, like I need a break. I need a 2-minute break, right? Or as preventative if we practice this in non-stressful times for lasting benefits. And then art, using art to de-stress as well. I mean, you don't need a lot of time, 20 minutes is all that you need, but a lot of studies have been done on drawing or coloring. It can be watercolors, it can be anything. You don't have to be a professional artist, you don't have to have any skills or ability, but this really helps us focus, bring ourselves into the present moment, and be mindful on what we're doing. It's an act of self-care, but it's also something that can bring us happiness, can get our creative juices flowing. And when those creative juices are flowing, we have more self-confidence, and then we have satisfaction in what we've produced or what we're doing. It's also an opportunity for us to get lost in or become engrossed in that task or in that activity that we're doing. Can be mindful, it's akin to meditation. It's something that can distract us too. Take my mind off this for a moment. I need to do something else, to think about something else. It's hard to overthink or ruminate or have negative thoughts when you're creating something. And it's also been shown to improve cognitive ability and increase our self-esteem. So again, it's all you need, but you need to schedule that time. Take it away. I'm going to do this, and I'm going to get that coloring book, or I'm going to draw, or I'm going to get those watercolors, and I'm going to do this 20 minutes, and I'm going to make sure I'm not distracted, and I'm going to do this and be mindful and focus on it. Now, I said mindful a couple of times. I want to talk about what mindfulness is. And it's a basic human ability that we all are able to do. We just kind of have to access it. But it's being fully aware, being fully present in the moment and of what we are doing and how we are feeling in that moment. And as the moment passes to the next moment, I'm mindful of where I am, how I'm feeling, what's going on around me. So I'm really focusing on what's happening right now. And it might be what's happening right now within my body, or what's happening right now within my immediate circle. Again, everybody already has the ability to do this. You just have to learn how to access it. Our minds lose touch with our bodies too often. You know, we become engrossed, or we start ruminating about these other thoughts over here. And I've done this before. I'm driving, and I start thinking about over here, and then I got to my destination. I think, oh gosh, I don't even remember how I got here because my mind was over here, right? Our minds separate from our bodies. And most of the time we're fretting about or worrying about something else, or about the future, what we should have done in the past. But mindfulness is something that we can do. It's available at any time. We can do it any time, just like we can do that deep breathing. But it's taking that moment to pause and think, well, let's everything just stop. Let me breathe, and let me take stock of what's happening right now. So a great exercise in using mindfulness is this sober exercise. And this was used, it was actually a technique created for persons that were in addicted treatment programs, but it's been adapted to help with other therapeutic interventions, general stress. So the sober technique really takes us out of the autopilot response that we have. You know, something stressful happens or something throws us off guard, or we kind of feel threatened by it, and we go into an automatic reaction to it. And it's a stressful reaction, right? Practicing this sober exercise gives us a moment to take pause, stop what we're doing, and deliberately allow us to choose a different response and be intentional about that response. So you can, again, we encourage you to practice this randomly throughout the day. So you become more familiar with it, you can become more comfortable doing it, and that way you can draw upon it or use it when there are more stressful situations that are happening. So how do you do this? It's to stop whatever you were doing. You're in this automatic kind of stress response, and it's to stop whatever you're doing, whether you're sitting there or you're standing or you're walking. It's I'm going to stop and just observe what is happening in your body and in your thoughts. So how am I feeling? Am I tense? Is my stomach hurting? Is my head hurting? I have that knot in my stomach. And what are those thoughts? I can't believe this is happening. Or, oh, this, not again, not again, not again. It's just observe them, not judge them, just observe those feelings and thoughts that you have. And then to breathe in with your abdomen, and then to breathe out and focus on the present moment. This gives a second for our body to stop that cortisol dump, lower that blood pressure. And then you can start to expand around your whole body and your surroundings. Start to observe what's going around in your immediate surroundings, okay? And maybe throughout your other body. And allowing yourself to say, I may not have liked that, text I just got, or I don't know how to respond right now, or that upset me. And that's okay, but I'm going to respond. I have the power to, and I'm going to respond in a better manner, a more helpful manner. And it's being mindful about what just happened, how you're feeling about it, and how you're going to respond to it. Not going into that automatic autopilot response that might not be so helpful at all. So another thing to think about is our thoughts and our perceptions, right? To reduce our stress. Negative thoughts, this rumination, this thinking about the future, which is anxiety, or fretting about the past, which is a lot about depression, really does distort our present thinking right now. It harms our confidence, it harms our performance, and it paralyzes our mental skills and our ability to perform great right now and make good decisions. And this can be a distorted thinking of these negative thoughts, but these really do cause real damage if we let them. If we continue to ruminate and just stay in those negative thoughts all the time, then eventually it's going to be the only thing that we think about. So if we have these thoughts that we tell ourselves, I can't do anything right, this is too hard, there's no way this is ever going to work, I can't believe I just did that, I knew better and I just did it, I'm so stupid. These thoughts that we tell ourselves, right, they cause real damage if we let them, if we really start to make them a part of who we are. So I love this quote, the greater part of our misery or our happiness depends on our dispositions and not our circumstances. So it's really about how we respond to situations, how we perceive them, or learn to change our perspective on them is really what's going to make or break our stress levels and make us be better, be more successful. So there is this Buddhist metaphor that I've recently learned about, and it's about the 2 arrows. So the quote is, if you get stuck by an arrow, do you then shoot another arrow into yourself? The obvious answer is no, of course not. And of course we wouldn't do that. But in this metaphor, he's really comparing pain and suffering. And what it says is, while pain can sometimes be inevitable, and this is that first arrow and represents pain or a negative event. It's that diagnosis. It's the change in condition, progress in the disease state. Pain is a natural part of life. It's going to happen to all of us. And it can be a minor pain, it's another doctor's visit, or it's that task I got to do again that I hate doing. Or it can be a major pain, like a diagnosis or loss of a loved one. These pains are inevitable. We all have these events, these negative events. We can't escape them. The second arrow represents suffering. So that second arrow is the one that we shoot into ourselves. And it's a result of how we react to the first arrow or react to that pain or that negative event. We may act in a way that creates suffering for ourselves. We may condemn ourselves or complain or point the finger or overanalyze. But by doing this, we make the pain even worse. So it says, well, the first arrow is inevitable. The second arrow is optional. So an example is, imagine if you were to go in and you were to find a pile of dirty dishes in your kitchen sink, and you become frustrated because your partner was supposed to wash those, they promised they were going to wash those the night before. That's the first arrow that gets shot, right? However, what happens next is now you're starting to think about the last time your partner failed you, the last time they promised they were going to wash up and they failed to do that. And other times they didn't follow through on their promises, and this leads to thoughts as, they really just don't care about me. I'm not even appreciated around here. So when your partner arrives home later that night, you start yelling at them, blaming them, shouting at them, lashing out at them for being a lousy partner. So these thoughts and actions are a result of that second arrow. So how can we avoid the second arrow, right? How can we stop shooting ourselves with that second arrow? So stop and think, consider a painful or a negative event. You know, it's that first arrow that you couldn't avoid. Now I want to stop and think about what you're thinking. What are those thoughts and what are those actions that you're doing that create additional pain or more negative outcomes on top of that initial negative event? What are the thoughts? What are the actions that caused us to fire that second arrow and create more suffering and more pain? You can ask yourself, what can I do right now to stop firing more arrows into myself? You might decide to focus on your breath. Move away, maybe physically step back or just stop wherever you're at. Focus on your breathing, because that will stop you from firing that second arrow. You can use that sober, mindful exercise, go through that. But being able to ask yourself, how can I stop firing more arrows into myself? And we want to make this a habit to use this 2-arrow metaphor when I notice that there's additional suffering in my life. Or I am ruminating about something and think, gosh, is it me that's causing this more suffering because I keep shooting arrows into myself? Some other things you can do is start to untwist those thoughts, those negative thoughts, those blaming thoughts, the ones that we tell ourselves. And this is what we call a distorted thought. And there's lots of distorted ways of thinking. Maybe you've labeled somebody or you've labeled yourself, or there's black and white thinking. There can be emotional reasoning. A lot of different ways we have distortions in our thought patterns. But if we don't stop to think about what we're thinking and stop firing that second arrow into ourselves, it really can skew our view on reality, because it becomes not just a thought that we thought, but it becomes how we actually feel in our beliefs, and then it becomes how we behave and how we act. So distorted thoughts, these negative attitudes, these negative reactions to that first event can change our perceptions on our world. It can become one-sided, it's unfair, it can be bitter, and it can be untrue too. And these distorted thoughts, if they're not stopped, or we don't stop firing that, or realize we're firing those second arrows into ourselves, they really can cause depression and anxiety, self-criticism, low self-esteem, a sense of hopelessness. And that's not what we want, because when we are that way, we can't provide the best care for our loved one. So we need to think, what are those thoughts that I'm telling myself? Because they do become what we believe about ourselves, and they do become our actions and our behaviors. What we tell ourselves influences our emotions and our beliefs. What we feel about ourselves influences our actions and decisions, and how you act and the decisions you make influence the thoughts that you tell about yourself, that influence your beliefs, that influence you. See, it can be a very vicious cycle. But the great news is we can stop that cycle. We can stop firing that second arrow into ourselves. And I think one of the first ways to know that is just to know that we have the power to avoid the second arrow. And we have the power to control our thoughts, change our emotions and our beliefs about ourselves. And we need to do this daily. It does take daily discipline to reflect on, write down, share with others what your strengths, what your accomplishments, and what your successes are every day. Keep track of those positives. You know, when I ask you to keep track of these positives for a week, every day, write them down or tell somebody else. What are your positives? What are your accomplishments? What are your strengths? And that way there's something you can go reflect on, and you have something to offset some of those negative thoughts. Sometimes those negative thoughts, we don't even realize we're telling ourselves, but you're offsetting that negative stuff. And then just start sharing the positive. Every time somebody else does something positive, praise them for that. And when we do this, it increases positive behavior in us, but also in others too. Another way to do this is to don't say anything to yourself that you would not say to someone else. I would never tell my dad, you know, I cannot believe you just did that. You are so stupid. I would never say that. So if I'm not going to say that to him, then I'm not going to say it to myself. Constantly encourage and praise and compliment yourself, and practice gratitude. And this is maybe you write a thank you note to somebody on that support team that you've created for yourself. Thank you for just being my support team, being part of that team, and practicing gratitude. While it's hard to get out of bed every morning, I am so glad that I have two legs that get me out of that bed every morning, and that I'm able to do this, and I am able to provide care for my loved one. You need to identify any areas of change that are causing additional stress. Do that and make those changes. Surround yourself with positive people. There's an emotional contagion. We pick up on happiness and negativeness and sadness and joy and frustration, and we tend to kind of act like those around us. So let's surround ourselves with positive people so we can be more positive. And work on spiritual needs. Focus on what your values are. I have found that when I am in a high stress or a long-term stress state, I've moved away from the values or the person that I want to be and what those values are. And a lot of times it's caring. I want to be a caring person, but when I'm in high stress, I've moved away from that. So I need to get that back. And a lot of this is through deep breathing, intentionally using music and art to relax. I do need to start eating well. I do need to start using more movement. And when something does stress me out or I've lost my patience, I do that sober exercise. I'm starting to identify what's that second arrow. What are those other arrows I'm shooting into myself? Working on these spiritual needs because I want to move back to the values of the person that I want to be and how I want to behave. Remember why you care. Sometimes we need to remind ourselves why we're doing this. And know that the goal is progress, not perfection. We're not going to do everything perfect every day. A mistake is proof that you're improving, you're getting better. And know that we don't have to go through this alone. Talk to somebody you trust. They can, first of all, help us see things from a different perspective. They can challenge maybe some of those distorted thoughts, or they can tell you, hey, you're shooting yourself with that second arrow. Let's work through this. And it could be through a great friend, it could be through a counselor, it could be through a support group. And then getting for and asking or accepting help. There are ways to ask for help that yield more yeses than nos. And we want you to start asking for help and receiving help or accepting that help before you think you actually need it, because you're going to be better, you're going to accept help more and quicker as your caregiving journey goes down the road. And first, you need to be honest with yourself about what your needs and strengths and what your weaknesses are. You may be able to be great with your mom most of the day, and I'm there most of the day, but I'm also kind of working from home. But so what I really need is some uninterrupted hours to get work done. I can't really do that with mom because there's a lot of interruptions. So I got to be realistic. While yes, I can work from home and I can be with mom and I love that part, I still need some dedicated, uninterrupted time to get some work done. It's just being realistic about my situation right now. So what are those realistic expectations or needs that you need and that your loved one needs as well? Some ways to get help from friends and family, right? Be specific. Be specific. And this is with the day or the time that you need, but be specific about what you want them to do or what you need them to do. If it's to come and sit with your loved one, all right, I want you to come. I want you to be there from the hours of 10 and 12. It'll be, all y'all got to do is sit there with you. We'll just talk to her, maybe read her or go through some photo albums with her. Here are some things you can do from these 2 hours. And also being clear to them about where your loved one is. Let them know what to expect as well, especially if they haven't seen your loved one in a little while or not aware of maybe the condition they're living with. Give them a good chance to do some education. And make strong asks. If I were to ask my brother, hey, bro, I know you're busy and you got a lot of stuff going on, but if you could possibly, again, I know you're busy, if you could come over on Saturdays for a couple hours and just kind of hand out help with mom, that'd be great. There's that ask, which is okay. I kind of already gave them an out, though. Or there's the, hey, bro, I need you to be here on Saturday. You can either do a morning or an afternoon, but I need about 4 hours that I got to get out of the house. And I need you to be there and sit with mom. What 4 hours can you do? It's going to be harder for him to say no to that second one than it was the first one. So be strong, be specific about those asks. And also don't ask somebody to come and help and just have them be a spectator. Most people want to help, they just don't know how. They've got to be guided on how to help and told how to help, and that's what they want to do, and then they want to do it on their own. So if you want somebody to come in and help out around the house or be with your loved one, then give them the opportunity to do that. Trust them to do that, and then you leave. And have a good list already ready, especially if somebody kind of says, hey, let me know how I can help you this week, or I know you need help, how can I help you? Kind of, I think I've got it because nothing's coming to me. But I bet if I asked each one of you, if you could write down at least 5 things that you could use help with on a permanent basis or on a regular basis, you could come up with it. Yeah, I would love for you to come visit with my loved one for an hour or 2. Yeah, I need help with the yard work. That would be great. Yeah, I could always use help getting stuff from the grocery store. You know, things like this. Have that list already ready so you can share that. And you write it down, hand them a Post-it card or a note card and say, here, choose. Here's 5 things right here, use those. And that goes into letting them choose if you have that list ready, and be considerate of their interests as well. If somebody hates cooking and they just don't do that for themselves anyway, I'm not going to ask them to cook some meals for us to freeze. I'm going to try to find something else they'd be interested in doing. And if you do have a hesitation, that's okay. We have to be aware of what's going on in their lives too with the timing. It might have just been bad timing, or they might not have understood what you asked, or sometimes there's just a hesitation, and that's okay. It's not a personal rejection on you. It's okay, I'll try again in a couple of days, or I'll come back and ask later. And then have a few people to go through and ask, not just keep asking that one person over and over again. Have a few people that you can go through. So that is my information. I know that Doni has a lot of resources to share with you just in the community to get help from and accept help from.
And Jamie, before I do that, can you say just a little bit about some of the programs that you all offer through James L. West?
Yes, absolutely. So we do, the James L. West Center is a long-term care community for persons with dementia, Alzheimer's disease or related dementias. So we do have a community here in Fort Worth where we have residents that live here from the early stages all the way up to the late stages. We're also able to provide respite stays, and that's overnight stays. From maybe it's 3 nights, you just need some rest, or your loved one needs some rest, all the way up to 15 days, I believe, if you need that kind of help, and they can stay here for a short-term basis or a long-term basis. We do have a day program. It's currently not operating because of COVID, but we are hoping to get that open up again soon. And that's somebody you can come during the day. You get the nursing oversight, you get meals, you get socialization, stimulation during the day, and get to go home at night. And then we have our education. So we, both Holly and I, do education for family members, for professionals, for students, and the education in every department here at the West Center really focuses on nurturing what remains in individuals that have dementia, and working with what's still left. So and we teach caregivers, how do you work with what's still left? How do you be successful so your loved one can be successful as well? So we do online programs right now. 30-minute programs to an hour programs. Holly facilitates several support groups, some weekly support groups, one monthly support groups that focus on grief. And then we partner with great organizations like the North Central Texas Area Agency on Aging and the Council of Governments to do programs in the community as well.
Thank you. All the programs I've attended have just been top notch, so it's just a privilege to partner with you all. So in just the few minutes we have remaining, I'm going to touch on just a few resources that can help caregivers deal with stress. And I'm going to focus on services that are available in our 14 county service area. However, these services are available statewide. They may look a little different from one region to the other, but again, these same types of services are offered throughout the state of Texas. So if we can go to the next slide, it's important to keep in mind that all of the programs I'm going to be touching on this afternoon are funded by federal and state governments, and there are no charges associated with the services. So next slide is a map of the North Central Texas area. You can see that Dallas and Tarrant counties are shaded, and those two counties are not in our service area, but each county has its own area agency on aging, has its own aging and disability resource center, and I'll tell you what those entities are. And again, although the services may be a little bit different from one region to another, similar services are available throughout the greater Metroplex. We can go to the next slide. So if you are just getting started and trying to find some services for a care receiver who's older, and when I say older, I'm generally referring to people who are at least 60 years of age. There are a couple of state programs that can provide you a good overview of services in your community, and those are the 211 program. So you can dial those 3 digits from any cell phone or landline. That's a service that's available 24 hours a day, 365 days a year, and an information and referral specialist will provide you information about meal programs, in-home services, and so on. You can also contact the Texas Area Agencies on Aging, and there is a statewide number. You can call, enter your zip code, and your call will be routed to your area agency on aging. So if you live in Collin or Denton County and you call this number and enter your zip code, you would be connected with our office. So again, those are kind of 2 good places to get started if you're not sure what's available. Then drilling down just a little bit, I'd like to talk about some specific services that are available through the area agencies on aging. And again, these services are generally available to people who are at least 60 years of age. There's some other folks who can qualify for these services as well, but the vast majority of recipients are over the age of 60. So the area agencies on aging fund nutrition services, home delivered meals, as well as congregate meals. The congregate meal sites, the senior centers, have been closed due to COVID, but we are starting to see centers reopen and looking forward to getting out and about safely. It's been a long time. And in addition to funding nutrition services, we also fund transportation services. So we work with a network of local programs that will transport folks to the doctor, to the senior center, to the grocery store, generally within the county boundaries. We also have benefits counseling programs which help folks understand public benefits, Medicare, Medicaid. If you're in a caregiving situation, these details can make you crazy. Not too many people love to read Medicare booklets or insurance policies. but our benefits counselors are kind of strange and wonderful people who just live for policy and trying to explain it in plain language. They can also help folks who may be struggling financially figure out if they qualify for assistance programs like Medicaid. There's some Medicare savings programs, Medicaid, low-income subsidies to help pay for prescription medications. All of the area agencies on aging also offer case management services that can provide temporary help, homemaker assistance, personal assistance. Most of the area agencies on aging will have residential repair programs, will pay for medical equipment that's not covered by insurance, and in some cases can provide temporary help with medical equipment and supplies, and in some cases can also help out with paying utility bills or providing temporary assistance with prescription medications. And then if we go to the next slide, the area agencies on aging also host the long-term care ombudsman program, and that's a program that can help family members or people who are thinking about placement choose the nursing facility or assisted living facility that's best equipped to meet their care. The program can also help people resolve complaints or concerns regarding quality of care or quality of life. We also help people return from the nursing home to the community. And then we also have an options counseling program that helps nursing home residents identify various community-based services that may be available upon return to the community. We do a number of preventive health programs to help folks learn how to prevent falls, manage chronic disease, diabetes, depression, arthritis, chronic pain. And then we also offer a program called Pearls, which is a counseling program for older adults who are dealing with either depression or sadness. And we have a Pearls counselor who stands along the participant, usually for somewhere between 4 and 6 months, and helps the participant developing plans for doing things that they enjoy. So now I'd like to turn from talking about services for older adults to focusing on just a few services for caregivers available through the area agencies on aging. The first program that I'd like to mention is our case management program. And this is a program that provides temporary help to caregivers. And we generally work with caregivers who are caring for a loved one who's had a change in health, change in status. Recently, in many cases, we're working with care receivers who are coming home from the hospital or being discharged from a nursing facility and may need some additional supports in order to have a successful transition. So through the case management program, we can do things like build wheelchair ramps, install grab bars, we can pay for leasing of emergency response devices and medical equipment that's not covered by insurance. So that may be an elevated toilet seat to make the bathroom safer to use. We also can authorize respite, and that time away is so important to take care of yourself, to manage your health. And so the respite program provides temporary help so the caregiver can take a break from his or her caregiving responsibilities. We also fund counseling through the Wellness Center in Plano, and they are happy to work with folks who live beyond the Plano area, who are willing to travel to their office. And there are lots and lots of other counseling programs that are available through the state of Texas, through insurance, that I am not going to mention today. And then we also are really proud to support a program called REACH. which is offered by the Alzheimer's Association of North Central Texas. And this is an intensive education and support program for family members who are caring for loved ones with dementia. And through this program, dementia care specialists will help family members understand the disease process and come up with strategies to deal with various challenging behaviors, whether it's somebody who is wandering or dealing with delusions, doesn't want to take a bath. Just a very, very innovative program that we're proud to support. And then if we can go to the next slide, I'd like to turn now to just a few resources for family members who are caring for younger adults with disabilities, and actually people of all ages with disabilities. So again, 211 is a great place to start. Information and referral specialists with 211 can identify community resources that are available, both for the care receiver and the caregiver. They're a great source of information about support groups, whether it's through the local hospital or the Alzheimer's Association or the James L. West Center. A fairly new program is the Aging and Disability Resource Center. And I say fairly new. Texas has had Aging and Disability Resource Centers for about a decade now, but they tend to be a well-kept secret. This is a source of objective information about long-term service and support programs for people of all ages with all types of disabilities. So through the Aging and Disability Resource Center, benefit specialists will help people figure out if there are government programs that can help with care in the home, with transportation, with minor home modifications, adult day activity programs, and so on. And all of the Aging and Disability Resource Centers offer a program called Lifespan Respite. So I mentioned just a few minutes ago that there's a respite program through the area agencies on aging. And through that program, caregivers of older adults can get a break from their caregiving responsibilities. The Lifespan Respite Program through the Aging and Disability Resource Centers serves a broader population. So if you're a caregiver of a 45-year-old child with Down syndrome, or you're caring for a young child with autism, the Lifespan Respite Program may be a good resource if you're looking for a break, you're not receiving respite services, and it would be difficult for you to pay privately for that service. And then I wanted to mention, in addition to the education and support groups that Jamie talked about, just a handful of caregiver education and support programs. And again, the common denominators with these programs are they are free. So the first is called Caregiver Teleconnections. That's a program that is supported by the WellMed Foundation. And through Teleconnections, there are I believe weekly education and support groups that folks can participate in by phone, different topics every month. The Alzheimer's Association has a number of support groups for family members who are caring for a loved one with dementia. And then there are lots of other agencies that may provide virtual caregiver education and support as well. If you're in the Fort Worth area, there's Dementia Friendly Fort Worth. If you're in the Denton County area, there's Stepping Stones. So again, 211 tends to be one of the best sources of information about those types of supports, and the area agencies on aging can also refer you to support groups or education programs in your community. And I've provided you my contact information. Again, my name is Doni Green. And here you'll see my direct phone number, my email address, and then our website if you're interested in getting more information about our services. So again, it's a privilege to be able to partner with the James L. West Center, and I believe we have about 10 minutes or so. And if you all have any questions for Jamie or for me, I encourage you to submit those via the chat function, and we will be happy to respond.
Great. Well, you're doing that, and we're allowing people to do that. If you could go to the next slide, Jamie, that would be great. I want to talk about next month. We're going to, our topic is going to be understanding the different types and causes of dementia. We're going to do it on the same date, but please note it's a different time. I had a conflict in the afternoon that I couldn't get out of, so we're going to be doing it in the morning. So I would just want to make sure we make that note. And you all will be receiving the flyer for that webinar with your follow-up email from today. Again, does anybody else have any questions? And then if you could, again, put them in the chat or put them in the Q&A. And then, Jamie, could I get you possibly to go back to the second slide and go over the CEU information one more time? I'm going to say that it was quite the thorough presentation.
Yes, you covered a lot of ground.
There's no questions. No, seriously, that's great. Go ahead, Jamie.
Yes, so you will get in the follow-up email this afternoon from Marty a link to complete the evaluation. Once you complete the evaluation through SurveyMonkey, then you will get your CE certificate within about 3 to 7 business days through the email that you provide on SurveyMonkey. And then, so the evaluation in the link, there is a time limit, so it will expire on May 11th at 5 p.m. So if you could just get that in before that.
And you had to attend today the entire webinar to be eligible, and I want to make that point because unfortunately we have to keep records on, CEU providers have to keep records on how they document the fact that the people participated for the time, and the only way we have to do that really is the record we get off Zoom showing the login and the log outs of the people that participated. So please understand that we have to rely on that. So anything else, any other questions? What type of CEUs, clinical or general? Someone asked.
Oh, we can do CEUs for social workers, licensed professional counselors, or if you just want a certificate of attendance, we can do that as well for anybody.
Daisy, if you could, I don't know if you saw my message to you earlier, but Daisy, if you could call me after this is over, I need to talk to you for just a minute, but I apologize for that, but I caught that you were on here, so I thought I'd catch you. Somebody said no questions, but just a comment on how great the presentation was. Incredibly valuable, evidence-based information. Thank you so much. Great job, y'all. This was a great presentation. Now we've got a few coming up. Hold on now. I just lost my chat. No, it's not your fault. It just went away on me when you were when the thing. Hold on. I can't. Oh, I see. It's coming back up here. Information. I am a geriatric psych nurse, and I'm eligible for C. Am I eligible for C? Am I also eligible for CEUs? A geriatric psych nurse.
So for this presentation, we don't have a nursing CEUs, but the one next month, we will have nursing credits available. So if you come back next month, we will.
Very good. And also the legal one we're doing later this month has a nursing CEUs as well. So if you're interested in that, if you just watch our flyers that come out or email me, I'll send you the flyer for that does have nursing CEUs. Thank you, very helpful. Thank you, wonderful information. Thank you, thank you, thank you. What number should I call you at, Daisy? I'll put it on here. If you hold on just as we're done, I'll put it in the chat. I've been participating in James Al West classes for a couple of years. They are my lifeline as I take care of my husband. Thank you, Jamie and Holly. Great job. Very good. Well, thank you all. Great comments. Thank you all so much. Doni, thank you so much. Jamie, thank you so much. We certainly appreciate it. We look forward to seeing you all back next month for next month's presentation.
And just a quick comment to the person who's in Arkansas. Can you shoot me an email and just let me know what community in Arkansas? And I'll do some research real quick and see if I can provide you some contact information for your community.
Great. Very good. Well, thank you all so much. That's all I have, unless you guys have something else. And Doni, the email's on. She just put it in the chat. Janet did. So, and I can get that to you if you'd like. I don't know if you're seeing that.
Okay. Okay.
Great. Thank you all so much, and you all have a great day.